So at this ASH, there's been a lot of focus on precursor disease. So we've seen some update on MGUS and then Smoldering as well. So obviously for MGUS, we've seen the data from the iStopMM trial in Iceland, where patients have been screened, and we've seen that screening obviously leads to earlier diagnosis, but did not have a negative impact on quality of life of these patients. We've also seen a new cutoff for free light chain MGUS, which I think is going to be very important. The other thing that we've seen is treatment trials for Smoldering. We've seen daratumumab single agent, we've seen treatment with carfilzomib, lenalidomide, and dexamethasone, and then also immunotherapies, bispecific antibodies, teclistamab for Smoldering patients. And we've seen very high response rates. So in that treatment trial with teclistamab, they included evolving Smoldering as one of the high-risk markers. So therefore, we need to look at what is evolving Smoldering. And this is what we analyzed in our data from Memorial Sloan Kettering, and this is presented by Dr. Teresa Klagi. We looked at 350 patients with Smoldering. And first of all, we looked at the baseline risk, so the baseline markers. And we saw that having a high baseline level obviously leads to a high risk of progression. But then we looked at the change in M-spike and free light chain ratio over the first year. And we saw that we did a grid search to look at the optimal cutoff for when we call it evolving M-spike and evolving free light chain ratio versus stable. And in this grid search, we saw that having an M-spike, a change in the M-spike of 0.4 grams per deciliter or more, or a change in free light chain ratio of 40% or more leads to a higher risk of progression. So in those that had more stable disease, the time to progression was around 200 months, versus those that had evolving M-spike was the median time to progression was 20 months. And for those that had an evolving free light chain ratio, the median time to progression was 41 months. So it's very important, obviously, to use the risk scores that we have to look at the baseline risk, but then adding the dynamic risk score, looking at the change over the first year, and if there is a change of 0.4 or more in M-spike or more than 40% in free light chain ratio, that leads to a much higher risk of progression.